In this video, we're going to talk about how to save your lower back from sitting too long. Some of you sit for hours and hours and hours all day long on the computer. You're driving your car, you're sitting down on the couch. It creates a lot of low back pain and sciatica and a loss of the lower back curve. Normally, the spine should have a small curve going forward in the lower back. So when you sit on the couch or a chair, your pelvis rocks back, okay? And then you lose the curve. So the curve is going to be pretty much flattened, and over time that's going to wear out the discs, okay? Because you're bringing your knee up and it's causing the loss of this curve right here. What I'm going to show you to do is just simply you're going to get a foam roller about this size right here. This is what I do. And you're going to put it in the very lower part of your chair or even your car. And it's going to put pressure on the foundation of the entire spine, the sacrum. Okay, and it's going to support the sacrum to the point where it'll allow the lower back curve to come in. It's much better to put it here than it is in the lower back. Okay, so let me just show you something. Okay, so what happens is you have this lower curve right here. This is called the lumbar spine. There's 5 vertebrae, and then it's supported by there's something called the sacrum. Okay, this bone right here. And normally you want this curve going forward right here. So when you're sitting, the sacrum curls back and you lose the curve because there's nothing to support the foundation. You're going to use this foam roller and you're going to put it right on the sacrum, not necessarily just right here all the time, on the lower part, and it will actually push the sacrum forward to allow the curve to come back. So let me show you how to do it right now. Okay, so look at the situation. We have your whole pelvis as you're sitting is rocked backward. That's going to cause a lot of pressure on these nerves back here because you're going to lose the curve. So sitting all day is a killer with low back pain and sciatica and degenerative disc problems, etc. So this is what you want to do. You want to get a foam roller, this little thing right here, okay? And you don't necessarily want to put it in your lower back for the arch. You want to stabilize the very foundation, the sacrum, which is this bone right down here. So you're going to put this right behind the sacrum, and it's going to naturally tilt your pelvis forward and allow the curve to come back really nicely. Okay, so you get the curve back, this foundation, and that way you have to sit either erect or slightly forward with your knees kind of going down right here, because with the chair, your thigh bone is coming up here, and that's dropping the pelvis back. So if we have a foundational support that's right in back of that sacrum, it rocks the whole pelvis forward, and so you can maintain that low lumbar curve. And these discs will stay open. It's great to reduce pain if you're sitting doing computer work for 8 hours a day. And then sometimes you can switch it. You could put it up here too, but the foundational point right here will be best. And you want to use that just to, keep the pelvis rock forward to keep that curve there at all times, okay? So go ahead and get one of these foam rollers, get a skeleton. No, you're not going to need a skeleton. Get your own body, and you could use a towel maybe, but this really works good because it's very firm. Okay, so I hope that helped you and it will save your back. Thanks for watching. Hey, I appreciate your attention, and if you're enjoying these videos, go ahead and subscribe, and I will definitely keep you updated on future events, live events, and webinars that we're going to do very soon.